So I'm an obstetrician gynecologist and very interested in fetal development. A lot of the roots of many problems we have in society today are with the fetus and exposures during pregnancy. We're particularly interested in the role of cell phone radiation exposure during pregnancy. What prompted us to get initially interested in this was a large Danish study, over 20,000 women followed, that looked at cell phone exposure both prenatally and in the first few years of life, correlated that with behavioral problems in their children. The study asked women to go back and rate, one, their amount of cell phone exposure during their pregnancy, the cell phone exposure of their children, and then behavioral problems in school-age children. And they found a significant correlation, in particular with the prenatal exposure, i.e. exposure during pregnancy, and to a lesser degree with the postnatal exposure. Of course, you could always postulate that this is just an association, just a correlation, that it wasn't necessarily cause and effect, that women who spoke on the cell phone a lot perhaps were doing other things as well that might lead to behavioral problems in children. Perhaps they just spoke on their cell phone too much and ignored the children, and that caused the behavioral problem. Was it really cause and effect? To clarify that, we did a study in mice where we randomized the mice during pregnancy to be exposed to cell phone radiation. Nothing different at all about these mice, and the cell phones were muted so that the mice wouldn't even know if the cell phone was turned on or not. So the mice were randomized during pregnancy to have the cell phone on top of their cage, and this was done throughout their pregnancy. And then we let them give birth, turned off the cell phone, and evaluated them with various behavioral tests as adult mice. What we found is that there were significant differences in these mice. The mice were hyperactive, their memory was decreased, and they had decreased anxiety. So they weren't paying attention to their surroundings. They were very active, hyperactive, and didn't seem to be bothered by this. They were bouncing off the walls with really not a care in the world. What we think this looks most like is attention deficit hyperactivity disorder. Of course, I want to just stipulate that mice don't get ADHD, but behavioral problems in mice after prenatal exposure looks very much like the behavioral problems that we're seeing in the large Danish study. When you have epidemiologic evidence in people, tight correlations, corresponding to clear cause and effect relationship in mice, I think we have some pretty powerful evidence that cell phone exposure during pregnancy may be harmful to the developing brain. Pregnancy is a very vulnerable, delicate time that when organs are developing, they are more sensitive to some environmental insults. And I recommend to my patients that they keep their cell phone away from their pregnant abdomen when they are going through their pregnancy and beyond. Thank you.